Sean Hopkins, the Center for Health Analytics, Research and Transformation, also known as CHART, at the New Jersey Hospital Association. Thank you so much for joining us. I want to get into what CHART is, and that's the acronym for where you work in a moment, because I know it's a new organization, but you have some important information out right now. Children are headed back to school, and you've looked at the numbers of measles, and they're startling.
Yeah, we actually, this is happened over the last 18 months. In 2018, there were 372 reported cases of measles in New Jersey. 372 cases of measles reported in the United States. 37 of those were in New Jersey, and 30 of them were in Ocean County. That kind of jumped off the page at us. We, as in New Jersey, we represent 2.7% of the national population, but that's 10% of the measles outbreak that was located in New Jersey. So we thought that was something that was illuminating, and we wanted to try and take a look at that. As you may or may not be aware, the World Health Organization said that in 2000, measles was eliminated in the United States, and in 2015, that it was eliminated in North America. We're now at risk for losing that elimination status because of the outbreak in New York and the United States, and obviously, as we just said, in New Jersey as well.
What is the reason for the increase in New Jersey?
Well, some of it has to do with the increase that we're seeing in religious exemptions. When we look at the number of religious exemptions in the elementary and high school age children that are taking place, 5 years ago, it was about 1.7% of the population. 17 out of every 1,000 students was claiming a religious exemption. In 2019, that has jumped to 2.6%, so 26 out of every 1,000 students is claiming a religious exemption. That's a 53% increase.
And that's the only exemption you can get in New Jersey. You can't get a philosophical exemption.
Not to my knowledge.
No, you can't. You can't. You can only get a religious exemption, which means when you have a rise like that, isn't it suspect?
It certainly is. When we see we mentioned Ocean County, we saw that there's really a hub of activity that was occurring in Lakewood. The measles outbreak, as well as the number of religious exemptions that are being claimed in that general area. So we tend to see a linkage when we look at those two elements, which is certainly why we wanted to come out with a report. As you mentioned, August was Immunization Awareness Month, and we're also in the back to school period. So we thought this would be a really good time to release a study that talked not only about measles, but about influenza as well, and the importance of getting vaccinations. Vaccine preventable diseases. There was a study in 2016 by Health Affairs that said that vaccine preventable diseases were costing the United States economy $9 billion a year annually. And that's just because of the increase in religious exemptions associated with measles, and also the fact that only 1 out of 2 Americans actually gets the flu shot every year. And 2 shots of the measles vaccine are 97% effective in stopping that virus from taking effect.
And because we haven't had measles in this country for so long, or at least a number of cases, we forget how dangerous measles can be. In other parts of the world, measles are deadly. Now, fortunately, we've had cases, but no deaths in the last several years. But that's a distinct possibility if this number keeps rising.
And you raise a very, very good point on that front. One of the things that we really highly recommend is that when people are going to do international travel, that they get their immunizations, they get their booster shots, whatever it ultimately is that they need before they travel abroad. Because in other countries, the immunization rates are not as high as they are in the United States. In the United States, what we're seeing is a drop in immunizations. As I mentioned earlier, only 1 out of 2 Americans gets the flu shot every year. But we looked at data from 2008 to 2018, and there's been a 13% drop in the confidence level of immunizations, and a 15% drop in the level of confidence in their effectiveness. So we're starting to see a little bit of an erosion within society of the value and importance of immunizations. And yet when we see that measles outbreak, we say this is why parents need to talk about what the immunization schedules are for their children. Get the shots.
It's funny, everybody focuses on measles because it is such a controversial topic, and there's a religious exemption, and there's an anti-vaccination movement. But the number of people that get measles and the number of people that get severely ill or even die from measles is either nil or small compared to the flu. The flu kills tens of thousands.
Well, more than that. I mean, in 2000, and the flu season runs from October to May. And in 2017, 2018, that flu season, there were 49 million influenza cases in the United States. That's 15% of the population. There were 1 million of those cases that were admitted to hospitals and 80,000 deaths.
I was stunned. I went to the World Health Organization website and looked up what they believe the next pandemic is going to be, and it's flu. It's influenza. That's what they're worried the most about. And yet, I think one of the problems is that the vaccination hasn't been as effective certain years, and people still get the flu even though they get the shot.
Yeah, contrary to the measles vaccine, which we talked about earlier, which is very effective when you get your 2 shots, 97% effective. The flu is a little bit more fungible, so to speak. It's really, they develop a new flu vaccine every year based on the strains that they saw in the prior year and what they anticipate coming. So the effectiveness is still maybe to the 40 to 60% level in terms of preventing the flu. But it still makes sense for people to get the flu shot. And the flu is very easily communicable. You don't start showing symptoms for about 2 days, but then for the next 3 to 5 days, you are communicable. Stay home from work, keep your kids out of school, wash your hands, cough into your sleeve, do smart things to try and prevent the spread.
I want to take a moment, first of all, to congratulate you on your position. You've been in it a little over a year in the founding of this organization, CHART. Explain what you do, what you provide for the public.
Okay, so CHART is a research hub within the New Jersey Hospital Association. We're established about a year ago to take data and do predictive modeling, data analytics, to try and stitch together different data sets to provide illuminating information for policymakers, community representatives, the public in general, about how we can ultimately improve health status. And so we've embarked on several studies. We've looked at mental health and substance use disorder in New Jersey. We've looked at the prevalence of chronic conditions and the immunization study that we're talking about now. So we ultimately have been established to look at not only clinical data, but what is commonly referred to as social determinants data, the foundation, the building blocks of health status. If I have stable housing, if I have income, if I am, receive a reasonable level of education, if I have access to transportation, if I can get to quality food stores, all of these are the building blocks to try and improve health status. When we start seeing patients walk into the emergency room, we're treating the condition, whether it's hypertension, diabetes, obesity, or the flu. We're treating them when they come into the hospital. What we really need to do is see where the hot spots are for where those conditions are occurring, and we need to look at the underlying data, and we need to start to
help people before they get to the hospital.
We need to elevate the conversation now to talk about how we can improve health status outside of the healthcare arena.
Thank you, sir. I appreciate you being in here. Sean Hopkins, Senior Vice President at the Center for Health Analytics, Research, and Transformation at the New Jersey Hospital Association. Jersey Matters continues right after this. Still to come on Jersey Matters, it's so hard to limit screen time for our kids. We've got some tips when Jersey Matters continues.